Hey guys, this is Avi here from Hamilton Physio and Rehab and Precision Physiotherapy. Today we're going to talk about, if you are noticing some clicking and popping and grinding noise with your jaw, and it is painful, uncomfortable, then what are a few things that you could do it at home. So I wouldn't want to today in this particular video. I wouldn't want to go about the reasons why do these clicking and this grinding thing happens. But if at all it's painful and uncomfortable, and you're having some difficulty chewing, biting on certain things, even talking for a longer period of time, chewing gums, or eating certain hard shell items, then these particular things could be helpful. You'd want to first make sure that you are seeking the advice from a person who is an expert with a TMJ problem. A lot of physiotherapists, chiropractors do extra certification, extra education when it comes to temporomandibular joint, that is your jaw, and then certain dentists also specialize in TMJ, and then they often would provide you information of whom to seek the right help with based on the problems that you're going through. So ensure that you are seeking the right person's help for this. Now, if at all you're experiencing a lot of clicking around this area and a lot of pain, these expert physiotherapists or clinicians, what they would do is they would do a lot of internal technique. So they would put the hand inside this jaw area internally and focus on certain muscles, which is pterygoid muscles, masseter muscles. So there's a chewing muscles. They come makes up that jaw, and then they would do some massage technique, some release technique around that area. And then they would do some joint mobilization techniques, that putting a thumb around the last part of your tooth, and then giving some sort of a glide so that you open up that joint and then don't feel a little restricted if your range of motion and mobility is a little limited. Of course, you may not be able to do internal stuff, but there are certain external simple stuff that you can do it for yourself. So a lot of times we notice that there's a lot of tension that people end up building in their masseter muscle here, some jaw muscle. So first is to locate your TMJ joint. So just where your earlobe is, exactly parallel to that, you find a little spot. You can open and close your mouth, and immediately you will find a bony prominence, and that's your TMJ and jaw. So you'd want to go a little lower there or a little in the front, and then have your two finger. And then that's the area that you build up a lot of tension, and then you want to go in semicircular. So you don't want to move skin, you actually go deeper there, and there's barely little movement there if you see, but your fingers are moving, and then you're going in semicircular motion, and then you clench your teeth while so it's a hold release technique where you put in a lot of pressure, you hold that area, you clench your teeth, and then you release. And that release is going to take up a lot of tension around this area, takes the pressure off that the jaw problem that you're having. Another underappreciated muscle, or sometimes overlooked muscle, is your temporalis muscle. So when we are doing all these movements and activities relating to the jaw, we are building up a lot of tension around this scalp or forehead area. There is a muscle called as a temporalis muscle that attaches to the top part of your temple. So TMJ is temporomandibular. This is the mandible, this is the temple. When they connect together, that's when it makes the TMJ joint, or temporomandibular joint. So what you want to do is just around the side of your forehead. This is the area, and if you clench your teeth, this is not as exaggerated as the other muscle there. But if you clench your teeth, you will find a lot of tension building around that area, and that's your temporalis muscle. So similar concept, once you locate that muscle, the idea is that to go into semicircular area. If at all your TMJ problem is giving you some headaches, then this particular exercise is really good and helpful for that as well. So semicircular, and then you build up tension by clenching your teeth, you hold, and then you let go after 3 to 5 seconds there. And these things would often take some, give you some release there, and would help with some pain management. Now the third is, there's a saying when I see my clinicians, some of you who are watching might just remember this. I say that every TMJ problem has to have some association with neck issues. However, and not the same as vice versa. Not all neck problems will give you jaw pain, But then if there is a jaw pain that you're dealing with, then there has to be some association with neck. Because if you see, our jaw is so close to our upper neck, so a lot of common muscle group, our sternocleidomastoid and our suboccipital, like your lower base of the skull muscles and all of these, and even the way that we are positioned is, if you are into long prolonged forward head position, doing your computer desk work or driving for a period of time in that sort of a posture, of course, now we've gone away from calling this as a bad posture. There's nothing called as bad posture. It's more about just being habituated to a one posture for a longer period of time, and that's bad. So if at all you're in this sort of a position for a longer period of time, it puts up a lot of stress around that TMJ or that jaw area for a longer period of time. So just about going into this sort of a comfortable position, repeating this every so often is shown to have some benefits around that area. Just imagine there is a string from the ceiling that's actually pulling your neck up. So if you find yourself, like, as much as I talk about this, I find myself doing this as well. But at the same time, I remember making that conscious effort to almost imagine as if my neck is being pulled up the string, and then I want to go into that sort of a position, sustain that for a period of time, and then come back. Any sort of rotation with your upper back would often give some mobility. So research, and even with our experience with our patients, the more we work on our neck, we loosen up some of the tighter structures there, we increase the mobility around that area, we improve strength in that neck area, and often has related to some relief in the jaw pain. These are some massage techniques, some mobility techniques. Now what do we do for some range of motion? So if you notice that with your clicking that your jaw mobility is a little limited, which oftentimes does happen, then we want to drive. So with our tighter muscle structure or tighter joint, what we do is a range of motion mobility training. So we want to increase mobility. So how do we do mobility for this? By self-stretch. So depends on how far is your mouth opening. You'd want to try and use your finger to be able to just between your mouth, and then you get some mobility. You sustain that for good 20 seconds. And then increase that length as per your tolerance and your comfort by putting that third finger as well. And then ideally, eventually that forefinger, so that you get good, nice little mobility and a stretch in your back, in your jaw. While you do that, you want to ensure that, though I demonstrated it in this position, it's a little harder. And the same thing, you take your neck back and up, you will suddenly notice that there is a little bit of an easier, you find that sort of movement a lot easier than in that other position. That was about mobility and stretch. And then one exercise that you can do for your strength training of your upper neck. So there are these deep neck flexors that you want to build a lot of strength. These muscles barely even work. So as the saying goes, when you don't use it, you lose it. And so these muscles often go really, really weak. That's again puts up a lot of pressure underneath the jaw. So the way that you want to do this is by doing a nice posture. All what you do is just raise your neck very slightly, so up above the bed. And this is about building stamina, endurance, because all those sustained positions that we talked about is about sustaining it for a period of time. So you can hold it for as long as you can, just one repetition to the maximum amount of time, and then couple of repetitions throughout the day. What you do not want to do is that you do not want to go too far up. You want to actually just ever so slightly keep it up like that, and then go back. So you will notice a lot of tension building around that area, and that's the muscle that you're focusing on. So give these exercises or movements a little try. If you're dealing with these jaw pain, still doesn't help, give me a shout, let me know. I'll see you on the next video.